Okay, hi guys. So my name's Brad, and I just wanted to share my journey with the medication Dupixent, just some of my medical history, and hopefully my story can help some of you who are maybe going through the same thing or maybe considering taking Dupixent and the price and everything. Um, so it seems like this medication can be used for a bunch of different things. I've been kind of officially diagnosed with eosinophilic asthma, but from what I can tell, it's very, very similar to aspirin exacerbated respiratory disease, which is AERD, and chronic rhinosinusitis with nasal polyps, which is CRS with nasal polyps. So I'll just give you a bit of my history and just what I've gone through over the last few years and my journey, and we can just get into it. And so about 2 years ago, I had a severe rapid onset of symptoms. I had never been sick before that, never had any asthma, allergies, nothing. It just kind of hit me like a truck, extreme congestion to the point where I was going through 5, 6 boxes of tissues every day. I couldn't function at all. Like I couldn't do anything. And especially during COVID, being sick at all, there's a big stigma around that. So it was really tough. I couldn't sleep, I couldn't do anything. Asthma and allergy-like symptoms I see in all the doctors you can imagine, ENTs, immunologists, pulmonologists, nasal surgeons, pretty much anybody you can imagine. Nobody really knew what was going on, and I think that was the most frustrating thing is being sick and nobody can figure out what exactly the diagnosis is. And so over that time, I probably did 10 prednisone tapers, which obviously really isn't good for you to be on steroids all the time, and about 5 antibiotic rounds at least, just to calm things down and reduce inflammation. And so just recently, I was in the hospital again and was in the ICU after a very severe asthma attack. And so this is kind of what led to the breakthrough of, finally getting a diagnosis because I was hospitalized twice, one just in the ER and another one, like I just mentioned, in the ICU. And both attacks actually happened after taking an ibuprofen, which is one of the big things of AERD or Samter's triad, along with chronic rhinosinusitis with nasal polyps. And so finally got a diagnosis officially. I have eosinophilic asthma, but also CRS with nasal polyps, which to me is the same as ARD. I'm not a doctor, but that's just kind of how I see it. Um, and so eosinophilic asthma is kind of marked by very high eosinophils in the blood. And for me, 2 times I got blood work done, I was at 5 to 600. And then about 5 or 6 years ago, I got blood work done and I was at 1200. So it's been something I've had for a while. It's just kind of reared its head most recently. And so, whether you have ARD or CRS with nasal polyps or eosinophilic asthma, there's not really a ton of treatment. You can get a polypectomy, which is just the removal of the polyps, which is what causes a lot of these issues, like not being able to smell. I haven't been able to smell in at least 2 years. You can remove the polyps, but you're not treating the underlying condition. So, of course, they're just going to come back. So, it's not a great option. It's more of a temporary fix, more of a band-aid fix. Or you can be on chronic steroid use, so prednisone all the time, which obviously isn't good for you, antibiotic use, etc., etc. But most recently, Dupixent is something that's come on the market the last couple of years, which is a biologic therapy, which is kind of cutting edge medicine. It's very safe, very effective, but it's also very expensive, as you can see with the dollar signs there. In Canada, without coverage, you're looking at probably $40,000 a year, which, who can afford that? It's crazy. Um, but there is a couple different programs that you can get funding, so I'd look into that, talk to your doctor. It's called the Freedom Program. I was lucky enough to be able to get coverage for it for 2 years for free, just to see how it works and then kind of take my next steps after that. And so I began my Dupixent journey January 7th. So that's when I took my first 2 needles. So that's obviously just a couple days from when this video is posted. And so you start with 2 syringes. I took one in each leg. And basically my goal with this is just to share my story, what I'm going through, what I went through, and just my journey with Dupixent and to see if it works, what are the side effects, what happens. And so basically I'm going to post a video every 2 weeks talking about how I'm feeling, if I have any side effects, if I feel like it's working, and just to establish a baseline the current medications that I'm taking is obviously Dupixent, and so you take that a needle every 2 weeks. I'm taking Blexten, which is my allergy medication, my Brio, which is my controller puffer, and I also do a Pulmicort nasal rinse, so I do that morning and night. And so yeah, that's my story. I wanted to keep it short, don't want to keep you guys here too long, but I just wanted to share what I'm going through and kind of document my journey with Dupixent and its effects and everything. So I wish you guys all the best if you're going through a similar thing. Stay strong, and I'll see you guys soon. Cheers.